Hello, any energy still left? Say hi. Hello, thank you. So thank you very much. I mean, all the heroes that are still here until the end. There are some shares open, but there's many of you still here. Maybe more than what we had in South Africa last time, in the last minute. But also all the attendees that left their families, their country behind, had to travel so long. I know it's a long trip. So we really appreciate the presence of each one of you. And we hope you enjoyed Brazil. We hope you enjoyed the conference. The people here that worked, they worked a lot to put this together. They did the best they could, and I think was an amazing. I mean, I think you should. This is your. You should decide if you liked it or not. But in our modest opinion, was a great event. But you made it great. For example, the party yesterday was a lot of fun. Who was in the party yesterday? You see, I knew it. Not many hands raised because the people that went to the party, they probably didn't come here today. So, and once again, Reginder, thank you very much for the leadership putting this together. I mean, there were many, many meetings, many discussions, every single detail. We had to all the sourcing, going to and making sure that we did all what we did, following the compliance, the sourcing rules that we have, both in Butantan and also in Fiocruz. Thank you, Mauricio Zuma, for co-hosting this as well. Thanks a lot, Esper Calas, that since the beginning was together with me betting in this event. For us Brazilians, it's really an honor. And I think that who was here in 2019, right? In Rio and now in São Paulo, I think you can see the two different cities. I know now you prefer São Paulo. So once again, thanks Deborah, thanks the team from Fiocruz, also that also deserves a lot of compliment. Thanks again, your team, Rajinder. We hope you will keep seeing each other, we keep doing business. As you said, this last session was great. Mainly when we said the words that we have to join forces, we have to exchange technology, we have to exchange knowledge, and also the session today that mentioned about human resource. As we keep saying, I mean, it's all about people. It's people that make process, people that make products, it's people that buy equipment, it's people that develop products, it's people that make the clinical research, and it's people that raise money that have to return to the bank sometimes, right? So once again, I'd like to give a round of applause to all of you, to all of us here. And thank you very, very much for being here.
Okay. Thank you very much, Saulo. It is so encouraging to listen to your powerful and inspiring words. I have the pleasant duty of making some closing remarks and wrapping up the 3 days meeting. So I think we'll start with the key challenges which have been identified for pandemic preparedness and response for the DCVMN, which are reaching the zero-dose children and helping achieve Immunization Agenda 2030, timely access to novel technologies, upfront funding, regulatory reliance and harmonization, and new vaccines, for TB, malaria, dengue, and HPV. And I'm very happy to share with you that we seem to be aligned with all these global objectives. I would like to summarize here, learnings from the 3 days and the advice that we have received from various experts who got together and their wisdom that they shared with us. So first thing was invest in yourself and position yourself differently. We will do that. Work on public dynamics and focus on speed, scale, and access. Bridge the gap between vaccines and vaccinations and a unified communication strategy. Vaccine safety surveillance, which is based on underreporting and data gaps, which is a critical challenge in vaccine safety surveillance, and therefore manufacturers, national health systems, and patients, all of them have to be brought together, and CEPI with DCVMN is working on this. High capital costs are becoming a big challenge to manufacturers because of the debt burdens and low margins. So therefore, innovative financing approaches such as blended finance, a mix of public-private funding, were discussed as solutions with focus on getting access to right type of financing by bringing in different institutions together. For the pre-pandemic collaboration, there was a call for building strong partnerships and technology transfer agreements to enhance pandemic preparedness. Strengthening national regulatory agencies and ensuring a faster WHO pre-qualification process are essential steps for that. For the regulatory harmonization, one of examples which was shared was the Brazil's Anvisa example of expedited COVID-19 vaccine approvals. It came out very clearly even on the last session that strengthening R&D ecosystem is going to be a very, very crucial step in addition to strengthening global vaccine manufacturing. And DCVMN's critical role was reaffirmed because developing country vaccine manufacturers produce the largest volumes of vaccines globally. And therefore, technology transfer and affordability are going to be the key factors. There was a clear focus on securing the demand forecast and demand certainty, that is the predictability of demand. I was advised to build new relationships, cross-regional, South-South and North-South collaborations and partnerships. Act faster than governments was a key word. Build more robust action plans. Take big challenges and learn to manage risks. We are absolutely flexible on taking risks and bold risks. We will do that. Environmental sustainability due to climatic change and resultant diseases, AI and digital health are going to be the new key game changers. Bioeconomy market is going to swell from $4 trillion to $30 trillion, thereby offering huge opportunities to be leveraged in the bioeconomy, biosecurity, and biosafety areas. So the take-home messages for strategic consideration and action plan for DCVMN going forward are: be conscious of the geopolitical changes, intensify advocacy by becoming a strong voice amongst policymakers to make big impact. Prioritize an integrated manufacturing and resilient supply chain system, including trace and track technology for an equitable access to low-income countries and low-middle-income countries. Build workforce development to attract young talent and provide novel training and education programs. Building the next generation of leaders in the vaccine industry and quality culture is the key for capacity building for long term. We need to be prepared with strategies for biodefense threats with pull and push mechanism and community engagement. Embark upon creating awareness about positive aspects of vaccines and counter vaccine hesitancy. And the word was think beyond vaccines. I have started thinking beyond vaccines. We'll talk about these things very soon with all of you. Now I have the pleasure to share a few announcements to this august audience, keeping in view the urgent need to build vaccine manufacturing capacity in Africa and encourage introduction and adoption of novel technologies within developing country vaccine manufacturers. The 25th General Assembly of the member companies has approved the addition of new segment of provisional new members who are either on course to be AVMA recipients or harnessing novel technology, even if not yet licensed, to commercialize a vaccine. This is an exception being done for some of these manufacturers, and they can receive DCVMN support in the coming months and years. And I am happy to announce that Atlantic Life Sciences Ghana, Africa, has been chosen as one of these partners. So let's give a big hand. DEK Vaccines Ghana, Africa is the second one. Genova Pharmaceuticals Limited, Pune, India, being the innovator of heat-stable mRNA vaccine, is the third one. And we have the second category, which is called prospective full members. Prospective full members are those who have not yet received WHO pre-qualification, but they have licensed vaccines from their national regulatory agencies. And these contain, these are comprised of GCBC, earlier Shanta Biotech Limited in India, which has been now acquired by an Indian promoters. Then Finlay Institute of Cuba, Center for Genetic Engineering and Biotechnology, Cuba. So big hand for all three of them. A lot of people have been asking me in last 3 days that what is the destination for next AGM? Any guesses? Those who know, please don't speak because it's confidential. But those who don't know, make a guess. Okay, so I have the pleasure to invite Dr. Soleh Ayubi, Deputy CEO, and Mr. Adrian Shahzari, Board Chair of DCVMN, to extend invitation to Bali, Indonesia. Fast, fast, you have to run. We have a time commitment.
Thank you for the opportunity and the trust for Biopharma to host the AGM next year in Bali. I suggest that all of you to bring the whole family, couple days or a couple of weeks before the meeting start, so you can enjoy the beautiful Bali. And also, please be ready to bring no suit, I think, because we're gonna have the meeting next to the beach, so it's better to wear, polo, batik, short pants, and we're gonna enjoy beautiful Bali with all the food over there. So I think that's all. Thank you so much, and see you next year in Bali.
So we had a very good meeting today, and I hope that next year in Bali we have a better, adventurous meeting. So meeting while we enjoy our life there. So see you all in Bali next year.
Thank you.
Thank you. Okay, so once again, it's a pleasant duty now to extend a heartfelt thanks with a sense of gratitude to all those who made this 25th AGM a grand success. At the outset, I would like to start by thanking our VIP participants in the inaugural session, Dr. Tedros, Director General WHO, Dr. Sania Nishtar, CEO Gavi, Dr. Richard Hatchett, CEO SAPI, who in spite of a critical medical emergency and family, took pains to call and ensure that his message is ably delivered by Ms. Emma Wheatley, Executive Director of Access and Business Development, SAPI. Ms. Leela Pakala, Director, UNICEF Supply Division, Dr. Jarbos Barboza, Director, PAHO, Ms. Regan Cardoza da Paula, representing the Secretary of Health of the State of Sao Paulo, Dr. Paulo Sergio da Oliveira, Attorney General of the State of Sao Paulo, Dr. Mario Moreira, President of the Osvaldo Cruz Foundation, and Dr. Ayoda Alakija, Board Chair FIND. I would also like to thank my friend and philosopher, Dr. Akira Homa. He has just left because he was to take the flight, so he has gone back. But let's give a big hand to Akira once. I would also like to thank all my colleagues, friends, past presidents, and international organizational chiefs who took pains in delivering their message for the 25th Silver Jubilee video, which we shared with you on the day one. I would like to also thank Dr. Bruce Alward, ADG WHO, who was kind enough to be here in person for a face-to-face, free and frank session with CEOs and board members. My heart goes out to thank international organizations like WHO, Gavi, SAPI, UNICEF, PAHO, PATH, BMGF, DFC, IFC, IFPMA, and all other member companies, chairs, speakers, and of course, you all. A big hand for you all. I take pleasure to thank my board members, Mr. Adrian Shahzari, Board Chair, Mr. Tiago Roca, Deputy Board Chair, Dr. Mauricio Zuma, CEO, Biomeningia, Dr. Sunil Gairola, Executive Director, Serum Institute, Ms. Rachel Park, again, she had to rush out to catch the flight, Mr. Venkatraman, Vice President, Bharat Biotech, Dr. Andrew Wong, General Manager, Shanghai Wotai Biotech, and our treasurer, Mr. Fernando Lobos. I would also like to thank the co-host and steering committee members, Dr. Esper Calas, Director, Institute Butantan, Dr. Saulo Nasif, Executive Director, Fundaco Butantan, Dr. Mauricio Zuma, CEO, Biofucros, and Mr. Adrian Shahzari, Board Chair, DCVMN. I would like to thank Hotel Grand Hyatt management team, GM Gabriela, Director Operations Carlos, Event Manager Natalia, Event Coordinator Thais, F&B team Isabella, and above all, the chef Daniel and his team for delicious food for all the 3 days. Again, I would like to thank Orbis and the team member Araceli and Raquel, as well as the hostesses who have been here all the time. Let's give a big hand to them. Let's thank AV Agency, Audiovisual Agency, R1, and team members Vivian, Thais, and Jessica. Although I don't want to thank, but I would like to thank Cvent for the registration of participants and the app. Of course, I'm going to have a word with him on something else. I would like to thank, I outsourced Mr. Salil Malhotra and Ankush Malhotra, who chipped in at the last minute to make sure that all your audiovisual and the voting and polling for GA went smoothly. This was a last-minute call, but they responded so well from India. They controlled everything, and everything went on smoothly. So a big hand for them. I would like to thank my friend Jan Hendricks for the script of the video, and also Frank and Grace from US, who really turned out the video, after several cuts and edits from my side. I am a little bit hard on them, but I think it has been great. And I would like to thank my colleague Ayla, who played a big role in getting the video done. So big hand for all of them. You had witnessed a sweet voice from our MC, Ms. Ludmila Botas, who had just left, but I would like to thank her in her absence. I think all of you had a great time last evening, because whatever feedback we got was fantastic, and très bien and all that stuff. So I would like to thank Veranda management who made it happen, as also the performance agency Gamma Producio. Again, I would be failing in my duty if I don't mention few names here, and I would like to call upon them to please come over. The organizing committee from Butantan, Deborah, Gilia, and Nicolau. From Fiocruz, Dennis, Talita, and Thais. If there are people available from design, international relations, communications, and event, and social media, please come on. And I would like to invite my colleagues and my team members, Sonia, Menka, Ayla, Tamire, Maina, and Prerna. Let me tell you, ladies and gentlemen, that this planning started way back in the first week of March 2024 for building a dynamic agenda. Of these 3 days, it took us more than 180 days. And this comprised of 31 sessions, 129 speakers, and selecting relevant topics, right speakers and chairs, gaining their consent, managing changes, including last-minute changes, shuffling, reshuffling, and everything. So this team has been, a heartbeat, and I might be taking the credit for everything, but the whole credit goes to all of them. So let's give a real big hand to them. No, photo is incomplete if I don't stand in this. 4 and 4. Oh. Okay. Not hiding. Ladies and gentlemen, I had committed to you, I will start on time and I will end on time. It is 5 o'clock. We close the meeting. Thank you very much.